So what do we use it for in dentistry? Definitely to reduce pain. So many of our patients come in with a complaint of pain. So and we do score. We have the pain score, and we use hypnosis to actually reduce the pain. Sometimes we use control room of the mind. Many techniques. I will just discuss a few in some of the common techniques that we use. So reducing pain and during the treatment itself. Okay, and it can be for a really anxious patient, we are able to perform some dental treatment. We also use it for habit breakers because thumb sucking can lead to a lot of dental problems. And so there are a couple of ways to manage thumb sucking, and actually one of it now includes hypnosis as well. Very interesting gag reflex, because I'll share a case about severe gag reflex. This is something that we battle with as well, because when the patient has gag reflex, sometimes it's very difficult for us to carry out any treatment. And in order to treat the patient, we have to put them under sedation, either inhalation or general anesthesia. So sometimes they have too much of salivation, hypersalivation during the treatment, and this can be an issue. There has also been, I think, a study on bleeding. So when you have, when you're performing a minor oral surgery, there was a research that showed that with hypnosis, the bleeding was better controlled. And as we know, many patients would require some form of treatment, and it can be quite expensive. It can be quite difficult, especially when the treatment is done in children, primary school children, young teenagers. So for them, they need to be motivated. And you might have seen orthodontic appliances that these children need to wear. So some of them are removable, not the fixed braces. Some of the removable appliances, they need to be compliant. They need to have the motivation to wear this a certain number of hours per day to get the desired outcome. And with children, this can be a challenge. You can design the best appliance, but if the child doesn't wear it accordingly, you're not going to get the results that you aim for. So I think in this way, hypnosis with the combination with motivational interviewing is something used. It really helps the child. That means it becomes like they don't even have to think about it. They know it. Okay, it's morning. I need to wash it, put it back in. It's in there. They are programmed to have it and wear it, and we can see better results for the children.